Hi, this is Dr. Nick. I'm the Incrementalist here with incremental insights for opening up your business and for better health. Today we're going to talk about how you approach this and the shift from lockdown into this opening up. We're seeing variations on a theme in different states in the way that people approach this. And the overriding message that I think I have is that lockdown is easy. It's easy to shut people down. There's very little sort of finesse to this, but opening up is really difficult to do, and it requires customization. It requires thinking about the way that you approach your business, your particular circumstance. Where are people coming from? Where are you in the country? And are the hotspots for the people that are coming into your business? Is it a very local business? And how do you mitigate all of that? Well, there's several things that you need to think about, and all of those sort of assemble into an approach. The first is screening. Are you going to screen people as they come in? How do you screen? How do you preserve people's privacy? And importantly, not embarrass somebody. Imagine being tested for temperature with one of these remote sensor devices at the entrance of a business with a big line of people, and somebody says, you have a temperature, you can't come in. That's a pretty challenging issue from a personal standpoint. I think one of the reasons that we're seeing a lot of resistance to the approaches and some of the things that are being forced on individuals. This is a country built on freedoms, and we need to sort of preserve that, preserve some level of privacy. I think you're going to have to think through this. And one of the ways to do this is to have a pre-screening approach that is perhaps a little bit easier from the standpoint of personal interaction, perhaps separate from the business, maybe putting that in a different location, having a process that occurs for businesses locally. And we certainly, as a group, as we think about this, as we're helping businesses, have some thoughts around this, and I think some pretty elegant solutions that are going to be quite attractive, that will diminish the individual requirements for businesses to be able to do that. But as part of this, perhaps one of the screening requirements that we see in certain circumstances is you pre-screen through question and answers that can occur on an app, for example. So we certainly know that you can ask people questions. You can do this over a phone. People are at least comfortable interacting with the app, but it demands a level of confidentiality, that people have to trust you. I think you have to have perhaps a third party involved in this that allows you to build that trust so that they feel like any information that they share. And that's certainly true from a contract tracing standpoint, as we build out the needs for businesses as well as for communities. So contact tracing will be part of some businesses depending on the circumstance, because if you have people coming in that have the disease, you need to alert the folks that they interact with. And if you have an employee that subsequently develops, that was unidentified but later develops COVID-19, then you have a responsibility, and certainly all customers are going to want to know, to be alerted so that they can communicate that. So these are a lot of the complex issues that are necessary to think about from a business standpoint. And one of the reasons that we really think that you need expert advice to help guide you through that process. Talk a little bit about the distance requirements. Where did this 6 feet come from? In fact, it was a 1980s outbreak of meningococcal meningitis, occurred in Texas, and they looked at a subsequent study of the spread of the disease from the origins of individuals that had it. In the classrooms, they noticed that the previous indications for distance weren't sufficient, and they could expand it to 6 feet. This is not a pure science. As we know, the spread varies depending on where you are. If you're in the outdoors, that's a great thing, because that disperses the virus. That's good news. It's one of the reasons that for any businesses that can open windows or actually serve food, for example, outside, that's a great place to be, and it's a good way of approaching mitigation of the disease for your employees and also for your customers. But if you can't, then you have to think slightly differently as to how you approach that. And then finally, let's talk about masks. We've seen a lot of folks resisting masks. In fact, the percentage of users in the community is widely varied depending on the community. I think there's this approach to this that says it's my right not to have to wear a mask. Let's talk about that just for a second. When I wear a mask, I'm wearing it for your benefit, not for mine. I'm protecting you, and I'm asking in return that you do the same and serve me the same principle of protecting me by wearing a mask. There are lots of variations in the masks. God bless all these people that have flipped their business, produced all of these materials as we struggle to sort of produce enough. Obviously, there are better solutions that I think we're going to see downstream. But the principle of wearing a mask is the same as we have in the operating room where surgeons wear masks. It's to protect the spread of any disease through droplets and emissions from the individual, from the surgeon. Same principle in the outdoors, obviously different masks. Now, there are different masks for healthcare workers who are interacting with people that potentially either have the disease or we think they have the disease, and that's a different approach. You hear all this talk about N95 masks, and just as a word of warning, folks that are wearing the N95 masks that come from building sites that are designed to protect the inhalation of things like asbestos actually do the worst possible job. Because what they do is they prevent the virus or prevent particles from coming in, but they have a little valve, if they have the valve, and that allows for the free flow of air and indeed the spread of disease. So if you actually have the disease, it allows you to spread it. So those are the worst sort of community masks. They're appropriate for building sites and protecting people in those instances, but really better wearing a cloth mask to protect the people around you. This is an absolutely American thing. It dates back even to 1918 and the Spanish flu, and you saw it in the differences in responses in different communities. San Francisco was a leading community that built purpose around fighting and preventing the spread of this disease. The government officials ran a full-page advertisement, wear a mask, save a life. And San Francisco built a community around that. People came together to help and support. Other communities did not do as good a job, didn't bring people together, actually suppressed information, worst possible responses, felt that people couldn't cope. Absolutely the wrong approach to this. We know based on experience. We need to share information, share it widely so that people understand. And I wear a mask to protect others, and I ask that other people do the same. How do you deal with that in the setting of a business? Can you force it? What are the regulations that allow you to do so? Again, this is the reason why we believe that you need expert help to guide you through this, and it's why I've teamed up with a group of folks to provide these services in a range of methods to help people open safely for the benefits of their employees and for their customers and the people attending their particular business. If you'd like to find out more, reach out to me directly. I'd be happy to share some of those services and the folks that I'm working with. Very excited to be doing this. I think it's incredibly important that we help get communities, businesses open as quickly as possible, but as safely as possible for everybody concerned. I'm Dr. Nick. I'm the Incrementalist, here with incremental insights for a better, healthier, open business and life.